I think it has changed how I look at patients and how I do medication reviews within the pharmacy on my own. So in that sense, it's ongoing. And that was one of the things that we wanted to accomplish with the project. We're not just working on these individual, talking to patients about polypharmacy. We also did presentations to healthcare providers in the region talking about polypharmacy, talking about what has to change about medication use in the elderly, and trying to kind of have that trigger in your head that when you see somebody who's over 65 who is on that medication, well, find out why. Find out whether it's still appropriate. Find out, ask those questions.
What we really want in the end to come from this is A, that you're well informed, but B, that you're on the right number of the right amount of medication.
Yeah, so basically we're going to go through each of your medications one at a time. And then I'm also going to ask you to let me know if there's anything that you're taking supplement-wise or an over-the-counter type medication on a regular basis so that I can get a complete list of your medications to have. And then we'll generate that list along with some recommendations, some information about each medication that we'll give to you at the end of the call.
And so we had 85 people in Tumbler Ridge, and over the course of a year, seeing between 2 and 3 people a week, trying to reduce polypharmacy, because if you're on 15 medications, almost a guarantee they're going to be interacting with each other and causing side effects and things like this. And out of 79 people, we made 226 recommendations. More than 3/4 of those were for reductions or stopping or tapering.
It was an hour's interview with two professionals discussing your medical problems, and it was very worthwhile. It left my wife feeling a little more comfortable knowing what she was taking with her medications.
Probably the one that we questioned the most was proton pump inhibitors, so medications for reducing stomach acid, which are intended to be for short-term use, but people end up using them long-term just because it's really hard to stop taking the medication once you've been on it for a while. If you stop it suddenly, you get a sudden increase in acid production, and all of a sudden you have heartburn and stomach pain, and it might feel worse than it felt even when you first started taking the medication. And so people just think, well, that means I still need it, but it just means you need to come off of it more slowly.
As the population gets older, there is just the tendency to keep adding more drugs, and it's always easier to start a drug than to stop it. Patients get attached to their medications, or they don't realize that their bodies change and they don't metabolize it as well. And so the dose that suited you when you were 50 might not be the right dose when you're 90. And that takes time to talk people out of medications, and there's not a lot of financial incentive for pharmacists to do that. But the more we can all work together, get even dietitians, social work, pharmacy, physicians all working together, that's only going to help patients.
In this day and age, there's so much misinformation. So you need people like Charissa just giving evidence-based, scientific-based information.
We know on an individual level that Charissa has changed people's health for the better. And certainly the latest collaboration with Dr. Helm in the reducing polypharmacy, that's been massive. And I think just because Charissa's been there so long, and so she's been there for them so they can trust her. And then when she and Dr. Helm were working together, it just made them that much more comfortable.